and they were talking about some statistics over there. They were saying that 10 million Americans currently have cancer, and 3 million are considered survivors currently. Putting it another way, the statistics tell you that 40% of Americans will get cancer every year, and 21% will succumb to cancer yearly. 600,000. All right, so the other thing that I thought was compelling here, they had a plaque over there that had a quote that said, "Cancer is the most curable of all chronic diseases in America." I was thinking, the most curable, I don't know if that's a boast, but it's all relative compared to what? Diabetes, heart disease, arthritis, Alzheimer's. So if cancer is the most curable, then what kind of war are we winning on those other chronic diseases? So this particular article basically said that the reason why we're losing the war on cancer is because all the research models are flawed. And they're flawed because they don't address what really kills cancer patients, which is what's called metastatic illness. Metastatic illness is when cancer migrates from the primary tumor to other vital organs like the bone, the brain, the liver, and such. And interestingly enough, the National Cancer Institute has spent 99.5% of the research money, $200 billion since Nixon declared war on cancer in 1971. 99.5% of those funds have gone to shrinking primary tumors in laboratory animals. And that's why we're losing the war on cancer from a perspective of a conventional oncologist, because you cannot win the war on cancer. You cannot save a cancer patient merely by excising or shrinking a primary tumor, because that's not what takes the life of the cancer patient. And yet that's where all the funding goes, because that's where all the patents come from, the drugs, right? So we now have this huge industry, which is one of the reasons why we're not winning the war on cancer, because everything is going toward patented medicine. This is another evidence that came out of the same article, and you're looking at metastatic illness on the 4 primary killers of cancer. This is called the Mythbusters Conference, so I'm here to pop some myths about why we are not even getting close to winning the war on cancer from the conventional perspective. So look at the flat lines, patients with distant metastasis, so it's colorectal cancer, lung cancer, prostate cancer, and breast cancer. They're all flat lines. That means progress is zilch. Once metastatic illness sets in, the success rate on those 4 major killers of people with cancer is virtually 0. And a horrible lifespan in the interim. This is an oncologist by the name of Dr. Bagwet, who wrote a book, not an article, but a book called The War on Cancer, An Anatomy of Failure, a Blueprint for the Future, and it's all based on the same things that were in Fortune magazine. And we spent this amount of money since we declared, so-called declared war on cancer in 1971. Well, that proves something. Anytime the United States declares war on something, it's a dismal failure. The war on poverty, the war on drugs, the war on cancer, the war on terror. It always turns out to be something that ends up having nothing to do with what the intentions were. Samuel Epstein, British medical doctor, started this website called PreventCancer.com, Stop Cancer Before It Starts campaign, how to win the losing war against cancer. Which means, since we're not winning it in the therapeutical realm, why don't we take a look at why we're getting it in the first place and stop it before we get it? And he's come up with some amazing data, amazing statistics, including